closed in the next 2 days due to culvert repairs, and that includes emergency vehicles, just FYI.
I just got informed today they're chip sealing from Kingston to Dalton on July 10th.
Oh,
It should,
no, I don't like chips.
just figured I should let you know if there's any medic calls down there.
They just FYI.
From now?
When you take your bike
July
out,
10th.
chip seal it.
Just July 10th?
Well, they said it should
Should
be
be one
open by
day.
the end of July 10th, but you know how they operate. And that
Chip seal on my
they're
bike.
gonna limit the, or they knock down the speeds and everything, so just precautionary.
And saying that, when we go through construction zones, and we're stopped, and we're going lights, sirens, please shut off the siren. Like, the workers know that you're trying to get through, and they really don't know this.
Oh, no way.
Do you
I-
have your new air horn on?
I want
They
the
do.
air horn,
They
I want
actually-
it all.
Up here, they were really good. They saw us coming, and they sent traffic through, and we were good to go. So they have been very good to us.
Really, could you go educate them and tell them that technically stop lanes both ways and then the ambulance comes through instead of trying to rush people
Trying to rush
through?
everything through.
Exactly, because now you gotta deal with all those
That's true, 'cause
bastards
then
in
they
front
still
of you.
gotta pull over.
Exactly.
So, saying that, and especially with this new one, I don't know what siren they have in it. It's still a federal signal, I think.
It's a Carlson.
Or Carlson. Well, that's what's in the rest of ours. It's incredible. It's either they lessen the dampening in the cab, or the siren's louder because it's loud.
So are the air horns.
Yeah. We'll do a round table real quick, I guess, since I said everything. Yeah. Cool. Dan?
I've been sending out the window work emails about paperwork. So, when I go on my 4-day, if your paperwork's 48 hours old at that point and I leave for 4 days, then I can't get it billed out until a week or two after the call, which is not good. The billing company wants it within 7 days. So please, by the end of your shift, make sure paperwork's either down there or you send me something letting me know why it's not down there, family emergency or what. Just because I've had some reports that are 3 or 4 weeks old that I'm still waiting on paperwork for. So just trying to get better on that so people can get bills in a timely manner instead of 3 or 4 months, after. That's it for me.
Heather? Ike?
I got all the Berlin football games on the schedule, so just look for those and make them up, and that's about it.
And that could be any crew. It could be actually just one person, that's all they need. But EMTs, whatever kind of mix you want to have in it. So, that's paid at $10 an hour for the standby.
Just make sure that primaries are staffed first. Preferred.
Bethany's not here. Did she send us anything, other than what we said in the association?
Nope.
Okay. Anybody else have anything?
I do.
Amanda does.
So do I.
I've been waiting. I had sent out, I think I sent out an email. If not, I was thinking about it. The time card still has Lenny's signature on it.
Oh,
Are we still
yeah, I
using
need to
that?
fix
Good call, that's what I was gonna ask him too.
Yep.
I
Yeah, I should
figured
do
it
that.
was probably okay, but I was like,
Yes.
eventually you're gonna ask us to use another time card, and I just
When you
wanna.
switch it, could you email it, please?
Yeah.
Yeah, I can do that.
Thanks.
I'll just email it out.
Is that all you have?
That's all I have.
Okay, me,
Sure.
don't frickin' email anymore.
How about what?
Okay, here's the thing.
Email you about what?
Just do
This-
like I was just
This when to work shit all the time. I get 3-4 frickin' when to work notices daily, okay? It's to the point now that I don't even look at them. I just go
Figured everybody
archive,
got them on
archive. Okay, we all know we have a staffing problem, okay? It's great that you guys are now including Princeton, but include us in the first time around. Don't send it 3 hours or it must,
Right.
we gotta figure something else out because you know what? I am the worst person, I don't look at it.
I do the same thing. All I do is see come in, I just like to look.
This is the honest to God thing. The only one I look at is Damien's because I look also for CPR and he's been my contact for radar. So everybody
You wanna know
else,
the honest reason why we do that? Because we're told we have to.
okay,
Because we have to, because this is what I get asked, well, how do you let your people know you have the thing?
Oh,
Send out
okay.
our emails. So
well then, and then
that's why
and Evan,
we
that I
do it.
can't argue with
See,
this.
on the other side, I like it because I look at it and go, oh, they got an opening tonight. Oh, Jay's home. I can I'll pick it up.
So that's
If
the
you don't
only
like the
reason, cause
emails?
I
It's an
agree,
opening
and
every
I
day.
hate, you know.
But you can
we
ignore
laugh
them.
too, cause we send them out and go,
I do.
our morning emails going out that we
So
don't have
can
standing.
we do like a code word if it's like something important, or can we put it?
Well,
Word.
I put it in.
But you can have your
in
way.
mine-
Pineapple.
Yeah, in mine I always say coverage, so as a
Yes.
line, coverage. So
Yes.
that's what it's coverage, and if it's
Yeah.
something else, then I put up there,
Okay,
CPR,
cause
stuff
I
like
just,
that.
Normally
Because I do the
CPR
same thing, I just see
You do
coverage. and I
radar
don't
stuff,
send
I
it.
send that to your email, not through when to work.
yes.
Normally it's for my
And
city.
you
But the thing is, my when to work goes to my email, so
You
Everything.
can change that.
everything, right.
Right.
Well, I
That's what I
know
was
that,
gonna say,
but
when to work, you can select the
I
text
absolutely-
messages, the
absolutely,
emails.
I know that,
But
but
then
then
there's
I'm
some
gonna miss
things that are
something,
go through.
exactly,
Cause like I
so,
do put some of the things through, cause it's easier to blast out a when to work than it need to go through.
absolutely, and I agree with that, and if that's what you're being told, then I totally get it, but that's just,
That's the reason why.
it's just like one day, all of a sudden, there's like 6 of them that come through, I'm like, are you kidding, I know you need coverage, I'm sorry, I'm not going to Berlin, okay?
Right.
You know, I just,
Right.
it,
And I
it's,
completely understand it, and that's,
I get it.
and I say that in my monthly meetings up in the city, I go, you know, people are numb to this, right? Like, this is
Yeah.
literally just and I don't, what else?
and
can
then
you
I'm
do?
afraid now I'm gonna miss, so I still open everything up, and it just frustrates the crap out of me.
Well, mine, I'll say, mine will always say coverage on it.
Well, and I thank you for that, and I just told these guys tonight that I was gonna bitch about it, because I have 7 emails I keep track of.
Mhm.
I don't have time to
Mhm.
sit and look at shit all the time.
And I just
So-
like it, cause my phone will go off, like, I'm off tomorrow, I'm sure it's gonna go off like 7:15, 7:30, and it'll be like, when to work coverage, and I'll just. But I agree, that is the reason we do it, is because at those meetings at the hospital, they go, what do you do? And then I literally go, look at all the when to work messages we send out. So that is why we do it.
Okay,
So.
Did
and-
we have some issues with when to work for a little while, because I wasn't able to sign on through my phone, and Adam had to sign me up a couple of times.
Was that when I took your permissions away? Cause. I
No,
forgot.
it was after you gave them back.
I admitted to that, that was my fault.
I know that Katie's email started going to her spam, and that's the only other issue that I know, because she was like, how come you're not emailing me? And I was like, I literally just sent one
I'm
out.
like, God, we've had really good coverage, I'm not getting any
Yeah.
emails.
Cause I
Yeah,
was like,
Kathy.
and then I sent her, I was like, this is your email address, she's like, yep, and I was like, is it in when to work? Yeah, they're there, check your
It
spam,
worked
she goes,
today,
oh,
but at
there
the
it
beginning
is.
of the month, it didn't work.
Now I have to retrain my email to send them to the regular inbox by logging onto a computer. Which-
Oh, I mean, that was your case,
I
so
haven't
you
known
didn't
any
get
problems
it.
with when to work at least.
You didn't
I
catch up.
didn't understand.
Well, the only thing I can think of is why you couldn't sign up is.
But he couldn't sign in, there's no reason he wouldn't be able to sign in.
No, I was signed in, I just couldn't grab a shift. They wouldn't let me,
Yeah, that would have been
Were you picking
decent.
up, hold on, now I gotta look.
I
bet you-
was
Well, I
able
took
to
his
do it
permissions
tonight.
away for a
but
while.
I
Are you
wasn't-
picking up a lot of shifts? Cause sometimes
No.
in when to work, why?
You can be limited on hours, so if you
Yeah,
hit
which
a
is-
certain
which is
hour mark,
dumb.
it'll stop you from signing up.
Really?
Shouldn't-
It's
Yeah,
never
I mean-
happened to Bonnie and
Yeah,
Aaron for
it's-
crying out loud.
Well, it's,
Yeah.
Because I never signed up for more than a couple days.
We
you
can, we
know,
can set it
if
per
everyone's
employee.
sick.
yeah.
Well, and it comes out as a.
We only like you
standard
2 times a week.
Only 12 hours, that's about max.
Reasonable, reasonable.
thing. I mean, look,
Emma's like, this is bullcrap, this ain't working.
Mine's like over 200 usually.
I'll fix it right now, that's the problem.
Was I maxed out on hours?
Well, you're only allowed to sign up for 4 shifts, apparently.
Oh.
Oh,
That's not gonna
sweetness.
work.
I wish.
So I'll fix that.
Well, I signed up for
Mandatory
2
4
already.
shifts, up to 10.
Like, wait, let me finish the week.
That's the reason though, 'cause sometimes that, I don't know.
Because Adam was able to sign me in without problem, but I wasn't able to.
Because the manager can
Yeah,
override
'cause
it.
you can override it as it says that.
And that scares the hell out of me that he has that power.
And 3/4 of the time he has to sign me up anyway.
So
so-
that shouldn't happen again. I don't wanna inhibit anybody from
I like
signing
when
up.
he sends the text messages that it's like,
So.
I'm available. And then I reply back, and then it's 3 hours later, and he's like, okay, I'm home now. And it's like,
Like, just send a message saying you're available,
I know.
3 hours later, I know.
sure, I'll take call with you for an hour, sure.
Oh, he's such a dirty.
Anybody else have anything?
I just, real quick one.
The EMT room down here got repainted and cleaned out, and we're working on new decorations and furniture and stuff. So there's a big bag of people's stuff that has been here and not moved for over a year. So I'm gonna bring that out. If any of it's yours or you know whose it is and they want it, let us know, otherwise I'm gonna throw it away.
guess
guessing
what?
a lot of it is people. who
Toss
are
it.
already-
Toss it, it doesn't even pay, if
Fair
they,
game.
I was gonna say, my, if,
Everybody's stuff that normally runs down here is in their boxes labeled the way it should be.
This is all
just
loose
free.
stuff.
Yeah.
I think there's a
Bedroom
brown sleep
set.
bag that's been here longer than I can ever remember too.
Yeah.
Nobody's ever used. Brown sleeping bag.
Oh, that was Steve Engel.
Why do we have it there? What do you mean you know whose it is? And you didn't even.
he was probably hiding it from him.
Move it and then fold it back up so somebody's using it.
That's
Jamie's
gross.
just secretly labeling everything. Oh, that's Steve's. Oh, that's Drew's.
Yeah, so we get rid of some
That's
stuff.
Dee's.
It's all up here.
What's scary is people use
Also,
it
does
on his
anybody need a
phone.
plastic shelf?
Or two.
do what?
A plastic shelf?
You need one?
No, no, no.
Oh.
I want one.
What kind of plastic shelf we talking?
Well, it's a plastic shelf.
We need to figure out what
Oh my
I
god.
need to know measurements and
It's a
stuff.
bag.
Yeah. Yeah.
There's something in the box, so that seems safe.
Nice.
Kinda looks like a jar.
Is that someone's alarm clock?
And a humidifier.
Is it their, I was gonna say, it's my sleep machine.
It's a CPAP.
Forever.
I guarantee it's something that Verizon dropped down a couple of years ago. Like, hey, you guys need this. And then you just haven't gotten it.
So really the
What
bag
did
should
you
just
give
go
her
to
my
Verizon.
lamp?
I think when he
That's
shows
my
up.
lamp.
No, drop it in.
Okay.
If anybody wants to drop it in Verizon.
Except for
It's
it's way
about
too
yay
bright.
big and about yay tall.
I'll take it.
Oh, those
Awesome.
are nice.
You got two?
You're gonna,
No, I have one.
Oh, I thought you said,
we could probably get rid of that other one.
Nice, that's a
One that
good
all the
shelf.
stuff's on that we don't know whose stuff it is?
Yep. That'd be the one.
The other.
Clear it
No,
off.
no, the stuff goes with it, you have to
You
say.
want Steve Engel's sleeping
The
bag?
other one's bigger.
No, thanks. I don't know what's in that. Yeah, I'll take that if you're,
The other one's bigger, so yeah, if you wanna get rid of that one too, cause we get rid of
One
that
that's
stuff.
about 10 foot
That's
tall
what
and
might be like
about
crazy.
Hey,
30 feet
No,
long.
You think you can help me
the
strap
bigger
up to
one
the
we
bike
maybe
for
could
the
use
rifle?
next to the cabinets for chargers and
wear
stuff.
Yeah, I was gonna say just.
It's
put it
plastic,
there.
it's not gonna rust.
Maybe we'll keep that big one then.
That would come
There's
apart.
that.
This one's been empty for a long
I
time.
don't know
But
if this
oil,
fits into my saddle
all that
because
stuff
of the
that's kinda
top.
over there in that corner, we could put on the shelf.
Okay, we'll do that then.
Move it out there for a while, if it works, it works, if not, we can get rid of it.
Also, does anyone need a clothes hanger, a rolling clothes hanger?
Oh yeah, the little wardrobe
Yeah,
thing.
does someone want that?
That's
I'll
nice.
give it to you for free.
that's really nice for when you have rummage sales, guys.
Well, there you go.
We
It
don't
sounds
want
like
to
it has a
sale.
home.
I can only bring so many clothes home. Oh my God.
It
My
used
husband
to-
makes
it-
them
it's
all
only
order
two
on it.
things.
Part though, you should
I,
get
I
it.
Try
say
not
that's
to
right,
throw
I
it
get in
away.
trouble because it'd be
Wait,
like-
yeah,
I'll
like-
ask at work and I can.
So, like,
can
how
shoot you a
big
text
is
or
that?
email.
It's about yay tall and about
I
yay
would not
wide.
put, I would
It's
not
about
put
yay
any
tall.
Don't
weight
put
on
a lot of clothes on it, cause it will bang.
Oh,
Okay, then never mind, I don't want
it.
it.
3 t-shirts?
I mean, it's really
It's
good
a
quality.
single
You should definitely
pull
take
up,
it.
over, and down.
I like how you're really.
Well, I was
Fantastic.
thinking like for my
That
wedding to
sucks,
hang
yeah.
the bridesmaids dresses on, but if it's not that, if it's chintzy, I
It's
don't.
something Lenny bought from
Oh,
the dollar store when he wanted to
Hey,
hang his
then no.
jacket up by the bed instead of walking into the office to roll it.
That's probably just one of those single pull babies that they have.
Oh yeah,
No.
it's
It's
janky
just-
as all.
It's totally stable and will work for anything you need it to use.
If you attach it to the wall.
All the
Right.
light things you have.
If you anchor it to something
I will
else.
give you warranty of it.
Oh yeah, no, no,
Right
no.
to the door.
That looks like it should be used for like monkey balls.
Oh, it's pretty sturdy. I lean on it when I
Yeah.
put my
Not
boots
bad.
on in the morning.
You know,
Here, put your shirt on it.
Yeah, it's a, yeah, laundry.
it is actually it's metal, so I mean you could get
Yeah,
scratched
how
with
much
it.
did you get?
Is that metal?
I don't know. I put some stuff on this one time and it tipped over.
Yeah, I think that's.
So-
Yeah,
How
no.
much stuff
Okay.
did you put on it though?
Like 4 jackets.
You could
Yeah,
put-
big
Maybe not
winter
jacket.
jacket.
Just
could
start
put
hanging
cement
those
blocks.
jackets on and then we'll
put
see
cement
what the limit
blocks
is.
on the bottom.
The weight limit, yeah.
Yep, it looks
Go
like.
If
on.
you can fit it in my car, I will take it.
All it comes apart.
Oh, that's done and done, don't even.
Oh yeah,
That's,
it'll fit.
that, are you kidding me?
Back the car.
Some
we got
assembly
we got a bunch of
required.
stuff.
Yeah,
Back the
there
car.
we go.
I don't want anything that's in that personal items bag.
Hey, there's a humidifier in there. That's
Not even. And
Not
Yeah, is
full.
it adjustable?
Oh, it's not. It doesn't go
Oh,
down. It comes apart.
Yeah,
I'll give
it's
you a try.
yours.
Like, who reassembled it? I don't know.
It's just some small assembly.
Look at this.
Yeah, they can get all
He
that.
did. He did. For you
Oh,
though.
so-
Perfect.
You're gonna start
Is
auctioning
there anything
stuff
else we
off.
can do over there?
No, run it
I
down
got,
for an
I
auction.
got a computer from 1994.
Right?
Well, that's getting replaced. So just in case you guys need a computer, that one, Damien needs a laptop, so we're taking Damien's laptop out, or normal computer out here.
Thank
Yeah,
God.
yeah. Valley Low.
Nothing's
I
on
will
the
say, if
ground.
anyone ever is getting rid of a couch, I personally think Berlin House could probably use a new couch. I don't know if anyone else up in Berlin would agree.
I just bought that couch.
But you sink into it.
That's not my problem.
Don't you need one of those little things that they sell, you know, the,
A sheet of plywood just.
Oh, yeah.
goes
Sheet
in.
of plywood.
Hey, you can take the
I've done
couch
that
that's
at
on
quite
the
a few
porch back
couches.
in there if you really want it.
Got sheet of plywood on it so you don't see it going down the bottom.
Oh, it came in
Yeah,
fast.
you probably
Station at
missed.
Green Lake.
Oh, why did that get thrown up the curb?
'Cause you
You know
were-
how heavy that is?
Cause you expected me to
It's
move
like
it from the
400
porch
pounds.
over.
Solid. No, you asked if you could bring a new couch. I said, sure, move the other one.
It's growing.
She moved
And
it.
then Damien got out.
I bet you could still put it on the curb and someone would pick it up and go.
It's Berlin.
I was
Put a free
on
sign
call
on
in Berlin
both
during
Oh, yeah.
a city cleanup day and the things that people were stuffing into their
I had
bicycles
no,
and.
I will tell you, I had nothing left on my curb and it wasn't even my turn to get picked up.
Mhm.
So,
So I should just set it out there.
Yeah.
Yes.
At Cammy's house.
our toilet was taken in a second.
Ooh,
I put our toilet out there and someone took it.
that's right, for lawn decoration.
I was just gonna say. it
My
probably
neighbor
ended
guy
up
even
somewhere.
called me about
Illegal
it.
to sell used
He's like, is there anything wrong with that toilet? I'm like,
Street corner.
Well, give it away, it's fine.
Shit.
Can't sell it.
Did you clean it?
there's
before
a
you
zip,
put it
like,
out
there's a
there?
zip tie holding the thing that you want, like.
You just have to reassemble it every few flushes.
Anybody else have anything? Now that I sold some stuff?
Did you read it?
Sold it for
Damien's on training tonight. Do we need a break?
No.
No,
let's
cause
go home.
I gotta get
No, I
going.
gotta get that H out of
Oh,
here.
it's gonna be pretty quick then.
Oh,
And the
okay.
move said shelf for video recording purposes.
Oh, yeah. Is that my responsibility now?
Yes.
That was better.
Evan's like, I will gladly move it.
Oh, yeah, I will
He's
make sure this
moving it, he's
goes.
putting it in your car for you.
I'm all about purging.
So tonight we're gonna cover some OB.
Right there,
It's
that black.
really just gonna be childbirth. I referenced the protocols, I'm following the protocols pretty similarly, and then I'm, the state paramedic curriculum is what I went off of, so. Paramedic curriculum covers everything the paramedics need to know on down, so. I'm not gonna cover like placenta previa and all that kind of stuff, we're not gonna cover in all of the diseases that could occur, but
Did you sign in? Yeah. Laura, did you sign in? I did. Okay.
yeah, I checked. I think everybody's good. I took it around. OB.
I agree.
I was thinking about bringing Lenny in. I texted him.
That's all that matters.
His
He
text is
told
not something I
every
can
war
bring up in this
story
meeting.
possible.
Can we-
All, what was it, 13,
19.
19?
You're-
All 19 for like 6
Can you
Yeah,
guys,
who knows?
can you guys see it? I'll be reading it too.
Good, because
Yeah.
my eyes don't see that.
So tonight we're gonna focus on childbirth specifically. So to begin, some signs and symptoms of childbirth, or that, it is in the near future. Lightning. Lightning is a sensation that the woman feels when the fetus descends into the maternal pelvis. She'll say the baby dropped. That is one of the first signs that she will know that labor is within the next couple days. Braxton Hicks, commonly called false contractions. These differ from real contractions because they're non-rhythmic and they have irregular intensity. So they won't be 10 out of 10 all the time. Some of them will be light, some of them will be extreme pain. Ruptured membrane, that's when the water breaks. That's a good sign that you're going to have a baby pretty soon. Imminent signs of delivery. So this is where we start to kind of worry about. Before these, if the water breaks, do a visual inspection. If you don't see anything like crowning, try to transport to the hospital. It's always better to have the baby in a hospital. We really don't want to be having them on the kitchen floors. So, imminent signs of delivery tractions are rhythmic, same intensity in every, from a minute to every 5 minutes. The other one is crowning. Once you can see the baby's head, you need to pretty much stop what you're doing and get ready for birth. First stage of labor. Labor is broken down into 3 stages. First stage is called early labor. This is the longest stage. Begins at the onset of labor, and it continues until the cervix is dilated to 3 centimeters. Now we're not inspecting for 3 centimeters, so this is just kind of food for thought. Contractions will be about 7 to 45 minutes apart. They'll last for about 45 seconds. This stage may take 8 to 12 hours, and then this is where the water normally breaks.
I hate to tell you, if you're only going to 3 centimeters, that could take days,
Right.
not just 8 to 12 hours.
Right.
Okay.
That's the common that the state says it takes. But it's just food for thought. You know, if she says my water broke, it doesn't mean, oh my God, break open the OB kit, throw on the floor and get ready. You know, you still have some time.
Might.
Might. Now, if it's an Amish in Kingston, might as well just throw your gown on her way. Second stage of labor is called the active phase. This typically lasts between 3 to 5 hours. This stage lasts from 3 centimeters till 7 centimeters dilated. Contractions will increase. They're going to be 3 to 5 minutes apiece, and then they're going to be at about 1 minute. They're going to last for about 1 minute, and they're going to be every 3 to 5 minutes. Third stage of labor, this is the transition phase. These phases normally last 30 minutes to 2 hours. This is the most intense stage of labor for the mom. Contractions will be described as long, strong, and intense. Contractions may overlap. So as she's getting relief from one, she'll go right into the next one. Physiological changes during birth. So the mom will experience some changes. First, the contractions. During the contractions, the blood pressure for the female is going to increase. Her heart rate's also going to drop. This is due to the pain and her bearing down trying to move the child. Supine hypotension. This is from the baby blocking the arterial blood flow to the mom's abdomen. If she's experiencing this, you're going to want to move her to the recovery position. Hyperventilation. I mean, most of you guys know there's going to be a lot of pain. There's going to be breathing pretty quick, moving a lot of air. There's also going to be a reduced sensation of a full bladder. So this also comes into play for preeclampsia and eclampsia. The problem we see here is that a full bladder may stop the baby from descending, so you may have some problems there. So if it's been a long labor, she just has been having contractions a while, you may want to ask when the last time she's had a bowel movement or has used the bathroom for sure. So fetal changes. Blood supply to the fetus drops. That's because the placenta has separated from the uterus, so the baby or the fetus is not receiving any blood flow from the mom. It's just receiving stores from the placenta itself. Normally it has enough to supply the fetus. A long drawn out birth, the baby may become anemic. Heart rate for the child will be anywhere from 100 to 180 beats per minute. The fetus will also turn inside the uterus as it prepares to descend into the birth canal, and normally does this during the lightning phase. Assessment. So during our assessment, you're going to just do a thorough, rapid assessment. Do everything you're going to do with a normal patient. Don't really treat them any differently at first. Don't focus just on the pregnancy. You're going to want to make sure mom's doing okay. Obtain a full set of vitals, as well as a detailed medical history. Drug abuse problems, stuff like that could affect baby development or previous births. It's also important to obtain a medical history specifically for the pregnancy and the previous pregnancies. So ask if she's had prenatal care, how the doctor visits have been going, kind of what she's learned there, and then previous births, difficult births, cesarean section, stuff like that. That's good to know as you're preparing to deliver a baby.
And how many babies?
We will be getting to that.
Okay.
Right there. So, important to use the GPA acronym. G, gravida, is the number of pregnancies. That's just the number of times she's been pregnant. Para is the number of live births, either vaginally or cesarean section. And then A is for abortions. This is just, this is important because depending on the type of abortion, you know, they may have went through the birth canal, so there may be some damage there. So that could affect how well she will deliver naturally. So in your reports, it's written, if you can see it. So my example here is the ladies had 2 babies, both were live births. So it's written G2, comma, P2, comma, A0. That'll let us know, and the billing company know that we did it, you know. And OBGYN that's taking over, or, you know, the pediatrician will also. If imminent delivery is noted, prepare the OB kit and request assistance if needed. It's kind of important to transport the baby with mom if safe. Feeding wise and stuff like that, we try to keep the baby and mom together just so there's no separation anxiety there. So you can always request Med1 just for an extra set of hands in the back. If there's complications or you think that it's just best to separate them, call for an additional ambulance. Doesn't have to be a paramedic ambulance, you know, AEMTs are definitely trained to take care of mom and baby. Childbirth. So as you're getting ready, the OB kit's all prepared. You're gowned up with your face shield and gloves. You're going to perform a visual assessment to confirm crowning. This is very important. If they're not crowning, try to get them to the hospital as quick as possible. In print, you know, if you're out in Princeton or something like that, you may just want to prepare. You can always contact Med Control too. Berlin, you're pretty close, so try to get them there on time. As you prepare for delivery, you can coach a patient to push as she feels the urge to do so. Also with her breathing, you don't want her to become hyperoxygenated and pass out. So try to coach that breathing. As the baby's head delivers, suction the baby's airway. This is going to be important. As they take that first breath, you don't want anything to go down into the lungs that shouldn't be there. Also, we'll talk about in a little bit meconium staining. So that's when the baby's first stool happens in utero. If they, you know, inhale any of that, that could lead to pneumonia and a bunch of problems. So definitely suctioning that airway is important. As the shoulders deliver, you may need to gently move the shoulders up and down to pass through the vaginal opening. Most times, you know, you can get away without doing this, but you're going to want to support the head and neck and then just move gently. You're not going to tug on the baby or anything like that. No traction on the baby whatsoever. You can cause more damage to the mom and the baby. So as the baby delivers, we try to get an APGAR score within 1 minute. So baby delivers, you want to dry it off really quickly, rub it, try to arouse it, you know, get it just crying. After 1 minute after birth, you're going to do the APGAR score. The next slide will have it. And then the APGAR score is also done 10 minutes post-birth, just to see how the baby's progressing along. Has anybody delivered a baby? Aside from- Well, yeah, I knew that.
In an ambulance? In an ambulance or in a hospital?
On a
Well,
kitchen floor.
Either.
How about that one?
Nobody's done it in the field, in the hospital at all? Yeah. Did they really hit the APGAR? Pretty hard? Yeah. I did 2 down at St. Mary's, and as soon as the baby came out, they weren't really worried about me drying off. The nurse was definitely barking APGAR, so it's definitely a good way to tell how the baby's progressing and if, you know, CPR is needed and stuff like that. So most OB kits have a list of what's contained. On the back side there should be an APGAR chart, so you don't necessarily have to memorize it. It's also in our protocols, so every ambulance should have either a paper copy of the protocols or you can, I have it on my phone. So that's also a reference that you can use. if you need to Google APGAR's chart, go ahead and do that. APGAR stands for appearance, pulse, grimace, activity, and respirations. So at 1 minute post-birth, you're going to assess for appearance. So if the baby's blue or pale all over, that's core and extremities, you're going to assign it as 0. If the patient's blue in the extremities, but the core is pink, that's a 1 point. And if the baby's pink all over at birth, that's a 2. Pulse, no pulse at birth is none. Below 100 is, or no pulse is a 0. Below 100 is 1 point, and above 100 is 2 points. Grimacing, if they have no response, 0 points. Weak grimace when stimulated, so that's some crying. That's what we're talking about here. Is 1 point. If the baby cries, pulls away when stimulated, that's 2 points. Activity, if there's no activity for the baby, that's none. If there's some flexions of the arm, it's kind of squirming around, that's 1 point. If the arm's flexed, legs resist extension, that's 2. Respirations, not breathing is 0. Weak irregular gasping is 1, and then strong cry is 2 points. At the bottom of this chart, you can see 0 to 3 is critically low, 4 to 6 is fairly low, and 7 to 10 is generally good or generally normal. You're hoping that the baby's 10 out of 10 that you can transport normally. If not, call paramedics for intercept. We can intubate and kind of do paddles if we need to, or contact med control and haul to a appropriate facility. So after the baby's delivered, you have done the APGAR on the child, all dried off, everything like that. That should give the cord plenty of time to stop pulsating. This is normally just after birth, within a minute or 2. So after the cord is done pulsating, you're going to clamp the cord about 8 to 12 inches away from the mom. That gives you enough room. If the placenta doesn't deliver, that gives doctors enough room to kind of work with that foot of cord, just if they have to pull manual traction. This also should be within, so far from the baby also. So 8 to 10 inches from the mom, 8 to 10 inches from the baby if possible would be perfect. Place clamps 2 to 3 inches apart, and then cut the cord in between the clamps. That's important. The one we had on the kitchen floor, we kind of placed the clamps far apart. When you cut it, blood does squirt everywhere, so it was a little bit of a hard stopper there. But yeah. This is also important because we can do paramedics. I'm not sure about advanced. I can't remember, and I couldn't find it on the state website. We can do umbilical IVs. So you don't want to do it too close to the baby, so you definitely want that cord. I think AEMTs is in the protocol now, no. So paramedics we can, so that's why we leave that extra little bit of room. Once the umbilical cord is cut, perform assessment vitals on each of your patients. You now have 2, you have to treat them separately. Deliver the placenta, that normally happens within 1 to 5 minutes post-birth. It's important not to pull on the cord. We don't pull traction on the umbilicus. So if the placenta doesn't deliver naturally, leave it in place, get to the hospital. If the placenta is in place for more than 30 minutes, that increase hemorrhage, the risk of hemorrhage increases by 80%. So you're going to want to get them to the hospital quick if that's not delivering. Transport all patients to an appropriate facility. I know Ripon doesn't have an OB anymore, correct?
Correct. Not right now.
And then I think Divine Savior Portage really doesn't like babies. So definitely make sure you're going to an appropriate facility. They're not going to like you in Ripon if you take a newborn and mom over there. They're going to probably divert you to Fond du Lac or something like that.
Will the helicopter take a mom and baby?
Helicopter does not like to fly babies. They
I
will-
didn't ask if they like it. Will they?
Not really.
Madison,
Just don't tell
Med Flight,
Just tell them
out of Madison, has a neonate or newborn specific team.
I know Theta Star won't touch babies.
So with the doctor on board, you'll have to request med flight. and make sure to tell them to pack their, newborn stuff.
What you have, right?
They have different bags, they have different ventilators, stuff like that.
Okay.
I believe they will not fly mom and baby in the same helicopter, so
So
if
mom
they
can
both,
go one and baby the other if it's a
Right.
critical situation.
right, they each get their own team,
Gotcha,
so,
okay.
um, yeah, good question. So maternal care, after birth, all we're doing is really supportive care. Massage the fundus, so the top by the rib cage, until it becomes firm. This will cut down on the risk of hemorrhage.
And it's not like just a gentle rub.
Right.
It's like,
It's
like
definitely
you're
a
kneading bread
strong
dough.
massage.
And the mom's gonna hate you because it's gonna hurt like a
Right.
Dickens.
Right.
It's a good terminology.
It is actually, spread dough.
And then you're just gonna monitor for postpartum hemorrhage and blood loss. If you want to, you can put a trauma pad in place of the vaginal opening. Every once in a while, just check the trauma pad, just see how much blood is accumulated. You don't have to stick your face down there to measure out the blood loss. Infant, we're just gonna try to keep the baby warm, wrapped up. Supplemental oxygen as needed, we're just trying to get over 92-93%. Paramedics, we can do PALS as needed, and then IV access. AEMTs can do IV access in the extremities with small gauge IVs, so preferably 24s, and if you 22s, possibly depending on the child's size. Or IO access, we have the infant peds needles, so that won't cause any major lasting harm to the baby. You just want to make sure the leg's not broken or they don't have a odd deformity that could lead to
Why would we give an IV to a newborn?
hypotension.
They're not doing good.
Hopefully, it should be.
Paramedics.
Just, okay, paramedics, but why would
So-
I
so
do
like-
an IV?
so if
What are
you
you
guys
gonna do
deliver a
through that
baby-
IV?
So say Med 1's not available for, we're gonna call in Berlin and you guys are delivering a baby. If the baby's not doing good, you're doing CPR, if the pulse rate's less than
Okay, so
100.
okay,
Right.
gotcha.
If you don't need to do an IV,
Well, yeah,
Yeah, definitely.
well, that's just it, I mean, we're talking, so the child's not doing well, that's, again, my helicopter, and I'm hoping, yes, to start an IV, but to do one because of something minimal is
right.
extremely foolish.
It's
on
gonna be a major
newborn.
thing if you're doing an IV.
Gotcha.
Plus, we'll probably request one.
So,
Yeah. And if it is something major,
Especially if you're going to rip and they're gonna ask for an IV.
their veins are gonna be
Don't
very
go
hard to
ripping,
hit, and
they're
then
not
it's
accepting
gonna
it.
be nose right off the bat.
They will divert you right to bottom line.
Just tell them.
They did deliver one in Ripon, cause we have an OB that comes there for
Right.
OBGYN for surgeries and stuff. His first day there, he got to deliver a baby in the ER. It was awesome. He's a
They
really
sent,
good
they,
doctor.
Yeah.
I assume they sent it out right away. after
I
it got
only,
scheduled.
we were so busy in ER, so I,
We have to stabilize it.
I'm assuming they would have, yeah.
Mm-hmm.
It's what pond too, right?
I believe
a
what
pond
pond does.
delivers babies.
I was gonna say, you go to pond too.
That's Divine
Where
Duck.
I took one with one.
Divine failure.
Divine Duck, okay.
Berlin's close.
I don't believe they take babies.
We're there.
They will if
No,
you
it takes
show up.
exactly 11
Well-
and a half minutes.
Any
If
place you
it's-
take
if
it, if
it's-
you show up.
If everything's going downhill,
I was gonna say,
Yep.
sorry, touch us.
they will if you show up.
Right.
That place will be
So
show up.
other than that,
A hospital's always better than the back of an ambulance.
That's right.
Yeah.
They don't
Maybe-
like it, but
Yeah, well, they can get
The
over it.
Berlin's open, they're open back up.
Yes.
Oh, they were close to.
preferably go to the hospital the patient's
They are always
desire.
like on again, off again.
If their OB is from Madison, a lot of times when I'm down in Dalton and stuff, we'll just go to Madison because it's a lot simpler. But other than that, IO access on an infant and newborn isn't gonna damage them permanently, so even drilling into a little bone, it's the same procedure as an adult. You drill till you feel the pop or the give, but you're using a really small needle. So some common complications with pregnancy, childbirth, or in the second and third trimester. Preeclampsia, that's a condition during pregnancy where the blood pressure rises sharply in an expecting mother. This affects about 5% of pregnancies. Signs and symptoms include severe hypertension, protein in urine. Again, there's no way for us to check that. Fluid retention or swelling in extremities. Now, some of these are common signs and symptoms of somebody that's pregnant. So just because you see swelling in extremities doesn't mean, oh my God, they have preeclampsia. Normally, prenatally, the doctor will figure this out and they know that they have preeclampsia, so they'll be able to tell you. Our treatment for this is really supportive care. We're not going to really treat the hypertension. We're just going to try to get them to a facility that handles their condition, cramps and stuff like that. Other than that, try not to fluid overload them. With the swelling in the extremities and the fluid retention, if you just dump fluids into them, you're just going to do more harm than good. Eclampsia. So this is a seizure in a patient that was previously diagnosed with preeclampsia. It's important to, when these patients, just because a pregnant lady is seizing doesn't mean it's eclampsia. It could be, if she has epilepsy or something like that. So it's definitely important to try to distinguish this. This is dangerous because the blood flow and oxygen flow to the fetus may be affected. Due to the shaking and stuff, there's more blood flow routed to the extremities, which may take away from the fetus. You really don't have to worry about, because she's seizing, she's going to deliver the baby. It really doesn't affect the uterine muscles at all. So hopefully the baby should, not go into premature labor, but it could have some brain damage or stuff like that. EMS treatment for this, EMTs and AEMTs, first responders, are supportive care, full set of vitals, try to do that. Recovery position, pad the head, make sure they're not beating on, metal. Paramedic, we can give mag sulfate. The dose for that is 4 grams in a D5 bag over 10 minutes. So all the paramedics should be familiar with how to do that. 60 drop on that bag, wide open, would give you about 8 to 10 minutes. So that's kind of our go-to there. As a last resort, we can use benzos. So Ativan, Lorazepam, that kind of stuff. It's important to remember that anything we give to the mom will affect the baby, so you don't want to just slam a bunch of benzos. It'll definitely affect the baby, and you don't want to do that. So if you're going to give benzos, you may want to contact med control. So more common complications for birth is a breech delivery. There are 3 different kinds or specifications of breech delivery. One is the complete breech. This is delivery of the fetus where the legs are present. This is both legs are present. So when you check for crowning, you see feet. Incomplete breech is this is where you see one leg, one arm. It's not they're coming out completely backwards. They're in there sideways. So this is not something. Any of the breech deliveries is not something we generally handle. You're not going to try to stop the mom necessarily, but you're going to try to have her not push as much, control her breathing, and get her to a facility as quick as possible. And then a frank breech, that's when the fetus's bottom, their butt, presents first, so their legs are completely curled to their core. The risk with these is that on the way out they can either tear the mom, causing hemorrhage, they can injure themselves, or the cord will become compressed against the vaginal wall and blood flow to the baby completely stops. You could definitely have some long-term damage to the fetus with that. If you have a presenting umbilical cord, if it's around the baby's neck as it comes out, gently unwrap the cord and continue delivery. Normally this doesn't cause any lasting effects on the child. If the cord presents before the baby, contact med control, rapid transport. If the medic's not already on the scene, call for ALS. It's important to note that if the cord presents on the baby's head, you can see it, and it's compressing the cord, this is the only instance where you can put a gloved hand inside the vaginal opening just to try to relieve that pressure on the cord, so blood flow to the fetus can continue. Meconium staining. So this I kind of talked about before is when the baby's first stool happens in utero. proceed with a normal birth, this doesn't mean that you need to get to a hospital immediately. This is just make sure your suctioning is, you know, I wouldn't say better than normal, but make sure you suction properly. You may want to clean the around the nose and mouth off, you know, wipe it off before the baby takes its first breath. Paramedics, we can do suctioning with the meconium aspirator. So you just use an ET tube, deep tracheal suctioning. Use a laryngoscope, insert it. The meconium aspirator is pretty easy to use. All you gotta do is plug the hole just like the Yankauer, and then slowly remove the ET tube. Each time you have to do that, if you need to do it more than once, you need to use a new tube. Don't ever stick a dirty tube, you know, back down there. You're kind of defeating the purpose. Notify the receiving hospital that you did have meconium staining, just so they can get their unit ready that wise. That's it. It's pretty down and dirty, pretty quick review of the protocols. Does anybody have any questions? I'm going to put the PowerPoint and the video from tonight on the Google Drive. Well, I'm going to put the PowerPoint on the Google Drive. The link for the video I will have, so if anybody needs to make it up or you want to watch this again, just email me or send me a window work message and I can send you. Other than that, I tried to have Moraine Park bring in the birthing mannequin. Being $130,000, they didn't let me borrow it. I was going to try to steal it, but yeah.
Does Melissa have one?
I sent Melissa an email.
Okay.
I don't think she's been receiving my emails. I think they're going into her spam. So I didn't get a hold of her in time.
Okay.
So maybe in the future, if she gets back to me, we can maybe try to piggyback that on a different train.
Gotcha.
So, yeah, just kind of a review of our protocols, and I'm going to try to do skills eventually.